The number of Americans with atrial fibrillation or an irregular heartbeat is skyrocketing, and technology is trying to keep up with the pace of the disease to ensure better outcomes from procedures. In tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker shows us the many ways doctors are trying to treat the condition.
When someone suffers from atrial fibrillation or AFib, there are many ways to go about treating it depending on how severe it is and how long they've had it. Dr. Manoj Pandey, the head of the section of electrocardiology at UT Health San Antonio, who also sees patients within the university health system, says the first is with medication.
Like many other diseases, you can start off with medications first, and that's often how we start.
And like many other patients with long-term AFib, the medication didn't work for his patient, Delia Gonzalez.
We were trying different medicines because, like I said, I had high blood pressure and I had diabetes.
The second way is through rhythm and rate control.
Rate control essentially means that you prevent the rate from going too fast, but the atrial fibrillation still persists. Rhythm control is different because we're trying to get patients out of atrial fibrillation.
Next comes what's called a cardioversion,
which is a simple shock to the heart under sedation to get them out of atrial fibrillation.
They did the paddles to check to see if I could get the AFib in rhythm, but it probably lasted just a couple of days and it came right back.
A very common procedure is called a cardiac ablation.
We place catheters up through the vein and into the heart and isolate what we call the pulmonary veins, where the triggers for atrial fibrillation come from.
What worked for Gonzalez, who had multiple strokes, was ablation combined with what's called a lariat procedure.
What that does essentially is close off the left atrial appendage so clots can no longer form in that place where 80 to 90% of strokes originate from.
Whatever it takes to get the job done. Jeremy Baker, KENS 5 Eyewitness News.
For more information about family health, call 210-358-3045. You can also find the rest of the Wear the Gown stories. Just head to wearthegown.com.